This is PediaCast.
Welcome to PediaCast, a pediatric podcast for parents. And now, direct from the campus of Nationwide Children's, here is your host, Dr. Mike.
Hello, everyone, and welcome once again to PediaCast. It is a pediatric podcast for moms and dads. This is Dr. Mike coming to you from Nationwide Children's Hospital. We're in Columbus, Ohio. It's episode 513 for March 8th, 2022. We're calling this one Throwing Injuries in the Young Athlete. I want to welcome all of you to the program. So spring is finally around the corner here in the United States. And with spring comes the beginning of baseball season for millions of young athletes, from Little League to high school, club teams, and college. And baseball season also means the arrival of injuries of many sorts and flavors. After all, baseball did invent the injured list, originally called the disabled list, and they renamed it the injured list in 2019. Among the common injuries of baseball are those associated with throwing and pitching. And these tend to be injuries involving the shoulder and the elbow. Things like rotator cuff problems, you've probably heard of those. Shoulder dislocations and instability, little league elbow, tendon and ligament injuries, and elbow fractures and dislocations. And some other conditions with fairly long, complicated sounding names that we will break down for you and try to explain as we move along. We'll talk about how throwing injuries are diagnosed and treated and rehabilitated and prevented, all important things. And to help us with that conversation, we have two terrific guests joining us this week. Dr. Tom Pommering is Chief of Sports Medicine at Nationwide Children's Hospital, and Herman Hundley is a certified athletic trainer, also from Nationwide Children's. They will be here shortly, but first, I did want to say welcome to the hospital formerly known as Mercy Health Children's Hospital in Toledo. They joined our hospital family this month, and they're now known by a new name, Nationwide Children's Hospital Toledo. So a very warm welcome to the physicians, staff, patients, families, and community of Toledo, Ohio. We're very happy to have you along as we journey together down the road of pediatric health and wellness. All right, let's get to our usual reminders. Don't forget you can find PediaCast wherever podcasts are found. We're in the Apple and Google podcast apps, iHeartRadio, Spotify, SoundCloud, Amazon Music, and most other podcast apps for iOS and Android. If you like what you hear, please remember to subscribe to our show so you don't miss an episode. And also, please consider leaving a review wherever you listen to podcasts so that others who come along looking for evidence-based child health and parenting information will know exactly what to expect. We're also on social media. We love connecting with you there. You'll find us on Facebook, Twitter, LinkedIn, and Instagram. Simply search for PediaCast. And then there's that contact link over at PediaCast.org. That comes directly to my inbox. And so if there is a topic that you would like us to discuss on the program, please use the contact link and let me know. And then finally, I want to remind you that the information presented in every episode of our podcast is for general educational purposes only. We do not diagnose medical conditions or formulate treatment plans for specific individuals. If you have a concern about your child's health, be sure to call your healthcare provider. Also, your use of this audio program is subject to the PediaCast Terms of Use Agreement, which you can find at PediaCast.org. So let's take a quick break. We'll get Dr. Tom Pommering and Herman Hundley connected to the studio, and then we will be back as we explore throwing injuries in young athletes. It's coming up right after this. Dr. Tom Pommering is Chief of Sports Medicine at Nationwide Children's Hospital and an Associate Professor of Pediatrics at The Ohio State University College of Medicine. Herman Hundley is a certified and licensed athletic trainer at Nationwide Children's. They each have years of experience diagnosing, treating, and preventing throwing injuries which are common in athletes of every age, from little league to the major league and everything in between. That's what they're here to talk about, throwing injuries in young athletes. But first, let's give a warm PediaCast welcome to our guests, Dr. Tom Pommering and Herman Hundley. Thank you both so much for being here today.
Hey, Mike, great to be here. Thanks for having us.
Thanks for having me, Mike. This is something we're both pretty passionate about, and we're happy to share some information with the public.
Yeah, we're really glad that you both are here. Tom, let's start with you. Throwing injuries are actually pretty common in student athletes, and over 2 million children participate in Little League activities alone. So just the sheer volume makes these pretty common. But are there other factors that make throwing injuries common in kids?
Yeah, I think probably the two biggest things are going to be throwing too much, too fast, too hard, and then for too long. And then the other thing, which is one of the reasons we have experts like Herman on our team, is having poor throwing mechanics.
Yeah. And kids also have these growth plates, right, that make them a little bit different than adults in terms of injuries. Speak to those.
Yeah, for sure. Kids have a growth plate in the top of their shoulder. They're humerus, and they have actually 6 growth plates around their elbow. So until those become mature and harden up, they are more vulnerable to the stresses of throwing actually than the ligaments and tendons.
Yeah. And so that's kind of the weak point of the shoulder and the elbow, those growth plates. And then, like you said, there's a lot of repetitive motion with throwing. There's high energy forces, and so all that is kind of a bad combination in terms of there being the potential for injuries. I also want to point out right now we are talking primarily about baseball and softball pitchers and throwers. But tennis players and golfers can have similar injuries, right?
Yeah, absolutely. People forget that those throwing motions, and also even the football is not a year-round sport. If you're a good thrower in football, you're also probably a good thrower for baseball. So those other sports mimic the throwing motion.
Yeah. How about bowling?
Probably not, but they have their own unique injuries.
All right. Okay. I don't know. I guess you don't really throw the ball, but there, it is repetitive motion, and there's some high energy with the weight of the ball. All right. So Herm, we talked about those growth plates in kids. What do you see in terms of throwing injuries in children and teens, and how are those different than in adults?
Typically, we see a lot of the same injuries or similar type of injuries in children and adults, but the biggest difference is with our young athletes, those growth plates. So that's when we see damage or alterations to the growth plate, inflammation to those growth plates. That's what we would call, Little League shoulder, for instance, or Little League elbow. Those are predominantly what we see in our younger athletes until they are physically matured. Injuries tend to lend themselves to the weakest point in the chain and the weakest point in that area. So the stress that's put on it by throwing places a tremendous amount of stress on the elbow and the shoulder. And typically those growth plates are the weakest areas of growth and bone. So in children, we see injuries to the growth plate. As they get older and more mature, those injuries typically present themselves into the ligamentous structures of the shoulder and the elbow. So things like the UCL sprains, labrum injuries, and rotator cuff injuries, and things like that. And older athletes when they're more skeletally mature.
Yeah. When a kid has an acute injury, so, they're throwing and all of a sudden their elbow is hurting a lot, maybe there's swelling involved, with the pain. That's not something they should necessarily keep throwing through. They really ought to be evaluated, correct?
Yeah, absolutely. And I think you have to remember the injuries to the growth plates can be just an inflammation of the growth plate, or sometimes if the growth plate is weakened enough, it can be pulled away or valsed off. So we really want to avoid that scenario because it complicates their treatment and sometimes even requires a surgery.
Yeah. It's one of those things where in adults, if you have some swelling, it's likely to be soft tissue injury. If there's a fracture, you're probably going to know it unless it's, a small subtle one. But with kids and growth plate injuries, even if there's a mild growth plate injury, now that growth plate is weaker. And if you continue to throw through that injury, you could really end up with a bigger injury, correct?
Yeah, absolutely. Plus, it's just more downtime. If you can catch this early and address it, you don't have to miss a big part of your season.
Yeah. And yeah, go ahead, Herm.
Yeah. What I tell a lot of my athletes is you shouldn't throw through pain. If your arm's hurting, you should stop and see somebody. That's your body. When you have pain in your elbow or your shoulder, soreness is one thing where you're a little sore after and you feel fine the next day. And that's perfectly normal. But when you're throwing and you're having pain, that's your body's way of telling you that you need to stop. Something's wrong. Something needs to be addressed. And that's when you need to seek out a physician.
Yeah. And, some kids don't want to do that because it might mean that they miss playing. But I guess if you take it from the standpoint that if you are injured, of course, as you said, the injury could get worse and then you're going to be out longer. But also when you're injured and you have pain, your throwing mechanics aren't going to be exactly the same. You're not going to be as accurate. You're not going to be able to throw it as hard. And so your performance is going to go down. And so sometimes that might be a way to motivate kids to actually stop playing and get help so that they can be at their best performance.
Yeah, absolutely. That should be a sign for coaches and parents too, when kids start to lose their control and just start to kind of shake their arm a lot, things like that.
Yeah. So let's focus in on the shoulder. Tom, what are some of the common injuries that we see in throwers that involve the shoulder?
Again, those younger throwers tend to have more of an injury to their growth plate at the top of their shoulder, and that'll present with just sort of insidious pain. And again, all the things we've talked about, like loss of control or velocity. And then as they get older, that growth plate becomes more solid and more stable. Those forces get transmitted more into the rotator cuff muscles around the shoulder, where they get tendonitis.
Yeah. Tell us more about the rotator cuff. I think a lot of people have heard rotator cuff and rotator cuff injuries. It's like one of those things that everybody has heard. But what exactly is that?
Yeah. So it actually comprises of 4 different muscles. Some people kind of use that rotator cuff sort of collectively as one group, but they all support and stabilize the shoulder and keep it functioning, like keep it in a position that makes it the most functional. So when your rotator cuff gets injured, your shoulder actually doesn't function the way it should, and then that leads to even more injury.
Yeah. You mentioned a sprain or a strain of tendons. Kind of walk us through, first of all, what is a tendon and what is actually happening when there's a sprain or a strain, or is there a difference between those terms?
Yeah, so tendons connect muscles to bone, and the tendons are relatively avascular. In other words, if you injure a muscle, it'll bruise and bleed, but tendons don't really have a good blood supply. So when they get injured, it's actually harder for them to heal. And so it, again, belies the importance of trying to catch these injuries early.
Yeah. Yeah, really important. And when kids do have these injuries, who do you usually have them see? Should they go to their family doctor, sports medicine folks, athletic trainer? Herm, you have some ideas about this?
Yeah. So first and foremost, they need to see their physician, whether it be their family doctor or sports medicine. We always recommend seeing a sports medicine physician, especially for sports medicine injuries. But usually our physicians refer our athletes to either a physical therapist or an athletic trainer, usually myself here at Children's. I do a lot of our throwing injuries and our throwing rehabs within our functional rehab department. We do a rehabilitation process and kind of get them working on their throwing mechanics and do a return to play progression. So it's a gradual return to play with emphasis on injury prevention and improving their mechanics.
Yeah. Heading back to the shoulder for a moment, Tom, if you look up shoulder injuries in throwers, a lot of the stuff out there that you're going to find, like if a parent just Googles, hey, what's wrong with my kid's shoulder? They're a thrower. You're going to see a lot of things in the adult world, like slap tears, for example, and sick scapula syndrome and all sorts of things. Do you see much of that in kids, or is it really mostly rotator cuff and tendonitis?
Definitely the older throwers who have a lot of throwing volume under their belt. They're more experienced throwers. They have a lot of longevity in their shoulder, especially if they haven't been doing things the right way. We will see things like sick scapula syndrome, which really is probably as much an overuse related problem where their mechanics are altered because they're just have a tired shoulder or a shoulder that's weak. And then we do see some labral injuries in older athletes, especially, again, if they've had a history of knocking their shoulder out of joint. That tends to injure the labrum, or just if their throwing volumes are just way too high in year round. And another, I'll just say kind of one good preventative tip, and this is based on good evidence, is if you can not throw for anywhere from, if you can take a 2 to 4 month period off a year not throwing, your chances of needing a shoulder or an elbow surgery go drastically down.
So you really need some rest at some point during the year. That's really important. And that can be tough because there's always these, traveling sports. And I guess in the middle of winter in Ohio, maybe it's a little bit easier to take that break. But if you're somewhere where it's warm all year round, it could be a real challenge.
Yeah, for sure. And this evidence actually comes out of the South, where they do throw just about year round. So it's funny, here in the Midwest, we find ways to do things in the winter. So there's lots of indoor training facilities. So it isn't too hard for kids to train year round. So again, if you can take a break or move to a different sport that doesn't involve throwing as much, that's often very helpful.
Yeah, absolutely. Let's move on down to the elbow. And Herm, this is going to be for you. What are some of the common injuries of the elbow that we see in young throwers?
Like we said before, first and foremost, it's probably going to be Little League elbow. We do see that probably most frequently out of everything, all the injuries to the elbow in our young athletes. I say the big three are going to be Little League elbow or medial epicondylitis or osteochondral defects, things like that in our throwers. So those would probably be the big three or the most significant three that kind of spend or take the most time to heal and recover from. We also see things like muscle strains and tendonitis of the forearm muscles, tendonitis of the triceps and biceps. So we do see that, at the elbow as well in our young athletes. And then as they get older, we tend to see a lot more of the, the inside of the elbow pain, which would be, your flexor tendonitis, your medial epicondylitis, and also sometimes UCL sprains, where those are going to be more significant injuries to the elbow.
Yeah. We've been using some terminology that parents may not be used to hearing. And so I want to actually just slip back up to the shoulder really quick. And Tom, you had said labrum. The labrum is a piece of cartilage that deepens the socket of the shoulder, right? So if you think about the arm coming into the shoulder, it's a ball and socket joint. And the socket that the ball fits into, the labrum is a cartilage cushion. Is that an adequate explanation of that?
Yeah, absolutely. We all use the analogy that the shoulder is like a golf ball on a tee. So the tee is the socket. It's not very big, and that's to allow the shoulder a really wide range of motion. So the cartilage or the labrum deepens that socket a little bit, but because it's soft tissue, it is more prone to injury. It's not as strong as bone.
Yeah. And then Herm, you'd mentioned UCL. I've heard that a couple of times. What is the UCL?
So UCL is the ulnar collateral ligament. It's the ligament that attaches on the inside part of the elbow that attaches the upper arm to the lower forearm muscle, which the ulna to the humerus. That is typically what most people think about when they hear the word Tommy John surgery. That is the ligament that's damaged during or ruptured that requires Tommy John surgery. So that's the one that probably the most significant injury at the elbow in our throwers. Typically we see it in older throwers, but we are seeing it in younger throwers as well, where they have those sprains early on, and that's going to cause issues down the road, even with the rehab and things like that, with pitching and with throwing. That's going to continue to be a problem moving forward with sports specialization, things like that. That's why we're trying to get on the front end of it with our young throwers.
Yeah. And then you also mentioned Little League elbow. What exactly is that?
So the Little League elbow is actually damage or inflammation of the growth plate at the inside of the elbow. Right at the medial epicondyle, there is a growth plate there where on the inside of the elbow, same area where that Tommy John ligament is, that UCL is, that growth plate can be inflamed, can be damaged by throwing. And that's typically what we see in our younger throwers. Middle school and elementary school and sometimes early high school age.
What about fractures and dislocations? So actually breaks in bone itself or dislocations of a joint. Do you see that very often in throwers?
We don't see dislocations quite as much, but again, you can, if you weaken one of those 6 growth plates around your elbow, you can pull that away because it is attached to a really strong muscle and tendon that's constantly pulling on that growth plate. So if you overstress that growth plate, it can be popped off.
Yeah. So you got again, another reason to take a rest and to pay attention to any pain and swelling and, figure out what's going on and not throw through it and then damage things even more. And then some kids may have a bone cyst or something that they don't even know is there, and the forces of throwing, could break their humerus. But there's no way really to know that till it happens, unfortunately. So Tom, what is the approach then for figuring out what is going on? Because from the kid's standpoint and the family standpoint, I'm a thrower and now my shoulder has started to hurt maybe, a week or two ago, and it's just getting worse. And now it's interfering with my throwing. Same thing with the elbow. Like, what is your approach for the kid that comes in with pain associated with sports?
Yeah, great question. I think that we've already touched on this. The first thing, most important decision you have to make is to stop throwing through pain so we can try to figure this out. So when patients come in to see us, part of the workup is going to be to take a really good history, a detailed history about their throwing practices, and we'll use that as part of our prevention and education. And the second part is making the diagnosis, figuring out which structure has been injured. Patients will get an X-ray because we want to look at those growth plates. And then once we make the diagnosis, we have a big discussion on how you got there, how not to be back there again, because we can make your injury get better. But if we don't change the practices that led to that injury, you're going to be right back in the office again. And this is, again, where Herman and his team do such a great job with rehabbing and helping them improve their throwing mechanics, which is almost always part of the problem.
Yeah. Do you sometimes have an idea what's going on even before you get the X-ray, just based on your physical exam?
Yeah, for sure. I think if we can reproduce the pain with some of our exam techniques or places that we push on, we get a pretty good idea of where to focus in on. Yeah. And in their history too is also important.
And when it started hurting, what they were doing, and what makes it worse, what makes it better.
Yeah, we'll ask. Again, with when you're asking an athlete about injury, you really are asking sport-specific questions. So for throwers, we'll ask them, what positions they play otherwise, because a lot of times the pitchers are the most skilled athletes on the team, and they'll also play shortstop or catcher or third, which are also high throwing volume positions. We'll ask them if they know what their pitch counts are, if people are counting. I like to ask them how fast they throw, because if they can fire that off, I throw 75 miles an hour, then I know that someone has a radar gun around, and that will encourage them to throw harder than normal. And then we'll, ask them, how soon into their throwing outings do they hurt? Is it getting worse? Does it hurt with other activities outside of throwing, such as batting or their everyday activities? So really just trying to kind of figure out how involved this is and how they got to where they are.
Yeah. Yeah. So all important, the history, the physical, and then getting those X-rays. And then once you figure out what is happening, there's really two phases of treatment, right? The acute phase right after an injury happens, and then the rehabilitation phase to get you back and ready to play again. What about the acute treatment? And I know it's going to depend a little bit, based on exactly what is going on. But what are some general principles for treating injuries that involve muscles and tendons?
So again, since these are usually overload injuries, the biggest part of the initial treatment is resting the joint. And if it's really sore, sometimes we'll temporarily put them in a brace or sling. But for the most part, we let them keep using their joint as long as it's not hurting with everyday activities. So resting, again, education. And then the other thing we do is we'll let them do things that don't hurt their elbows. So for example, they can do some conditioning, some running and jogging and stretching, things like that. So they're not completely out of their sport, but we do want to protect the joint that hurts.
Yeah. What about ice and heat, and which one is best?
Yeah, age-old question. So, and I think the short answer is nobody knows, but here's what I tell patients. If it's swollen, if there's any swelling or acute pain after an activity, I ask them to ice. If it's because if something has swelling, the heat will actually make it swell more. So the only time I really have people use heat is if they're just warming the area up and it's not acutely injured. And again, I don't know that there's a right or wrong answer, but that's the general guide I give patients and families.
When we work in the emergency department and the urgent care center, it's always RICE, rest, ice, elevation, and compression. But really the rest is probably the most important part, correct?
Oh, absolutely.
And the rest of it's really comfort measures. And then of course there's also, pain medicine and nonsteroidal anti-inflammatory drugs like ibuprofen, for example, that can help reduce swelling and help with pain that you can use as well. And then what about the more significant injuries that involve the growth plates? What does the immediate treatment look like for those?
Yeah, this is where rest is really essential, because that growth plate has the ability to repair itself, but it won't if we keep stressing it. So that does involve a certain period of rest. Sometimes that can really be in the matter of even weeks. Yeah.
And if the growth plate is moved or coming away from the bone, then that could potentially require a surgery as well to put it back.
Yeah, for sure. Now, it depends on how far it's been pulled away, and kids are pretty resilient. But again, we just don't really want them to even be in that scenario if we can help it.
Yeah. If they do have any kind of surgery, and this may be a motivator for kids too, is they're out for a lot longer after a surgery than if you catch this early and rest it. I mean, it can be months that they're off if they have to have a surgery on a growth plate, right?
Yeah, absolutely. And the other thing is, I think there's kind of a common misconception, and maybe it's based on pop culture and movies, that, if you get a Tommy John surgery, you're going to come back even stronger. And that's just not true. In fact, a certain percentage of folks who end up with a Tommy John surgery will never return to their previous level of throwing. And that recovery for that surgery is about a year. So, and sometimes longer.
Yeah.
So it's, we really want to kind of keep people out of that scenario if we can help it.
Yeah. And so more reason that if your child has pain and they throw a lot, make sure that you see a sports medicine physician and get the right diagnosis. So Herm, talk. So we have the acute treatment of the injury, but usually the things are feeling better in 7 to 10 days. If it's a sprain or a strain, but you really lose a lot during that time, and you can't just go immediately back to where you were, right? There's got to be a rehabilitation process. Tell us about that.
So kind of piggybacking off of what Dr. Pommering had said. The doctors will refer patients to us during that rest phase. So when they're resting from throwing, so that we can start addressing other issues. So what will happen is they'll come to us and we will work on the elbow or the shoulder in terms of pain modulation and helping kind of improve their pain, control their swelling, things like that. And while they're resting from throwing, they're still going to be, potentially be hitting and running and fielding, as long as that's pain free. And then while during that time, we can work on range of motion and flexibility of their lower body, core strengthening. We can start working on scapular stability and improving their shoulder strength while they're recovering and while their body is resting from those injuries. And then that really rolls into phase 2. Is once they are pain free again, we can start to progress strength more and do some more weightlifting type activities, power exercises. We use a lot of medicine balls in our rehabs, especially for our throwers, for rotational power and upper extremity power, things like that. And then that's when we would start to incorporate a soft toss, light throwing, maybe some first base play. And then we would begin their progression. We would do a video analysis on their throwing motion, break down their mechanics, kind of start working on some of those correctives, trying to clean up the mechanics a little bit to decrease the arm stress. And then during that time, they'll start a return to throwing progression, which is a gradual progression where they start really with soft toss and then build up to more of a harder throw over an extended period of time, which slowly will take them back into their sport.
Yeah. How long would you say that whole process takes from, the acute injury to where you're back to where you were before?
So it depends on the injury. It really does. So, we talked about it earlier, the longer you wait to get your arm looked at, the longer that rehab process takes. We have kids that come in with, slight strains that come into us early and they're like, hey, I feel little something. And we can usually rehab them pretty quick and get them back to their, throwing within about a 4-week stretch, 3 to 4 weeks. For some of those more significant, little league elbow, little league shoulders, some of those, take 8 weeks, as long as 8 weeks, or even sometimes longer, depending on how significant. Obviously, if it needs surgery, it's much more significant period of time. But I would say anywhere between that 4 to 8 week stretch is kind of common.
Yeah. And a lot of these seasons, don't last much longer than that. And so that can be pretty tough for kids, right? I mean, we see a lot of kids get pretty emotional that they're out from their sport.
Yeah, kids struggle with that. Especially those kids who are the really good athletes that are typically you're going to be your pitchers and your shortstops, right? Coaches have a lot of pressure on them to win, and when their best players are out, when their good players are out, it puts a strain on the team. But with the athlete being out, it's hard for them. That's why we try to keep them involved with their team as much as possible during that time. Keep them, in the batting lineup, running bases, pinch running, fielding during practices, and if we can, we allow them to throw from first base, which is much lighter throwing, so that they can still be involved, still help their team. And then, be that way it's not, excessive stress on the arm like a pitcher would have, or a catcher or third baseman, shortstop, something like that.
Yeah, absolutely. So let's talk a little bit about prevention, because if we can prevent these things from happening in the first place, then kids are not going to miss that much of their sport. And I would suspect this is really, from a prevention standpoint, the responsibility of a lot of people to make sure that the things that we're going to talk about actually happen. The kids themselves, motivating them to make good decisions, but also parents, coaches, athletic trainers, school officials, team physicians. I mean, everybody's got to kind of come together to really make prevention of these injuries a priority. So what are some of the things that these folks can do to help kids not get injured?
So I don't like the term injury prevention, because no injury can be 100% prevented, but we can definitely reduce the risk of injury. There's quite a few things. And like you said, everyone is responsible. Everyone has a responsibility to help reduce those injuries. So the best way to help reduce those is going to be with proper warm up, making sure you're resting a proper amount of time, after your games and after your events. You're taking time off after pitching, things like that. So you're following the recommended pitch counts, you're following the recommended rest guidelines, and you're doing what you need to do for recovery. So getting the proper amount of sleep, making sure your nutrition is there. Also for our younger athletes, I think being mindful of our pitch types, not just our pitch counts. I feel like a lot of young athletes are, they want to get to those breaking balls, right? The strikeout pitches. And they don't develop their fastball and their changeup for a long enough period of time. And they don't perfect that before moving on to trying to get those breaking balls. And that's going to alter your mechanics and put excess stress on your arm, which could create injuries. They say the curveball, creates elbow pain. That's not necessarily 100% true, but going to a curveball before you've mastered your mechanics definitely will cause some issues. The other thing is making sure that you're strong enough, you're flexible enough, and you have good conditioning levels, because fatigue does play a role. So as kids fatigue, they're going to start to alter how they're throwing the ball, which could increase stress on their shoulder and their arm. And then obviously, like we've talked about before, proper throwing mechanics. Every injury that I've ever seen, I've never once had a kid throw with perfect mechanics. There's always something there. So it's a combination of using it too much and doing it incorrectly, whether it be a little bit of both or a lot of both sometimes.
Yeah. So Tom, did you have something to add?
I was just going to add that I think for sure kids also, you have to remember when they're not pitching, if they've thrown 60 or 70 pitches in a game, moving them to catcher or shortstop may not be resting the elbow. So putting them into a position when they're not pitching that's not super high throwing volume is important. I think the other thing about pitch counts are you have to remember that they're just a guide. And my advice to parents are that the pitch counts tell you when you should absolutely stop. And but if you start having pain before the pitch count, that's really when you need to come out. So I think parents need to remember that, because the pitch counts don't really take into account your warm-up throws or other throws you do outside of game situations.
Yeah.
Piggyback off that. Oh, sorry.
No, go ahead.
To piggyback off of that, when we talk about, fatigue and pitch counts, parents and coaches can really play a role there. When we see a kid's mechanics start to break down, when we see them start to struggle to hit the strike zone, we start to see them, alter how they're throwing. But typically when you see that loss of command, loss of control, they start walking kids or they start missing their spots. That's a really good sign that things are starting to break down, and they're either fatiguing or they're just starting to break down in their mechanics. And that's a good sign to say that's their pitch count right there. That's where we want to pull them from pitching. And then that, as they build up their arm strength and build up their conditioning levels and strength and things like that, that number may go a little higher, but that's kind of a good breaking point to make sure that kid comes out, whether that's at 60 pitches or 100 pitches, depending on their age.
Yeah. When you talk about pitch counts, over what period of time are we talking? Is it how many pitches in a game? How many pitches in a week, in a month, in a year? I mean, what kind of time frame are we looking at with pitch counts?
So there are different pitch counts published out there. Many are pitches per game, and then they'll also talk about pitches per week. And then the more pitches you may throw in a game, the more time is required to rest between pitching outings. So again, I think you have to remember, if you're not pitching but you're catching, you're still throwing the ball pretty hard back to the pitcher. You're throwing every bit as much as the pitcher is, and sometimes more if you're throwing the balls down for people stealing the base, things like that.
Yeah. And it's really important to think about those other times that you are throwing, and because those don't get counted into those pitch counts. So like you'd mentioned, if you are pitching and then they take you out and put you in as a catcher, you're just still throwing. So it's something that parents can advocate for their kids. Hey, this is still using their throwing arm, right?
Yeah, absolutely. And I think, again, skill and control are what you should be emphasizing early on, and not speed or velocity of throwing. And it's the amount of throws that really damage the joints more than necessarily than the type of throws. It's just the sheer volume.
Yeah. And do those pitch counts change depending on age, or are they pretty much the same across the board?
So again, they do lengthen based on your age. And there's an assumption there that the older you are, the more skeletally mature you are. But if you've all seen kids, who are younger, some kids just mature more quickly than others. They're bigger, they're stronger. Other kids are not as physically and skeletally mature. So this is where the pitch counts aren't a one size fits all. And you really just need to pay attention to having elbow pain, or, as the things Herman mentioned, those clues that they're losing control and having issues from mechanics.
Yeah. Yeah. Great. Herm, I wanted to you've worked with lots of pitchers of all ages through sports medicine, and sometimes you see kids who don't really have an injury. There's nothing nothing's hurting, nothing's swollen, and their mechanics change for some reason, and they're maybe not as accurate as they were. They go through a stretch where they're just not pitching as well as they had been before, and then they have a good stretch. Is there a mental aspect to pitching? I mean, we see this in the major leagues, where pitchers have a good stretch and then everything, kind of falls apart for a while. What do you think of that?
There's definitely a mental aspect to pitching, just like any other sport. But when you're in game as a pitcher, you're on an island by yourself, essentially. So ball's in your hand, and it's you versus the batter, and that's what it boils down to as a pitcher. So there's going to be stretches where you get dinged up. You're gonna give up home runs. You're gonna give up a run. It's really important to have some mental fortitude to be able to kind of battle through that adversity in game. But also there's going to be stretches where guys go through rough patches. You see this all the time with all-star pitchers in the major leagues, the best of the best. They're going to go 3-4 games and they're just going to get smacked around. And really what it boils down to a lot of times is just resetting and kind of taking a step back and looking at your mechanics and looking at what you're doing and what's different and going back to basics, back to your fundamentals. How did you get there? And just kind of resetting your brain a little bit. A lot of times, they'll send those guys down to the minor leagues and just, give them a little confidence boost, going up against some younger guys and just getting a little bit of work. They may deem it as a rehab outing or whatever. But ultimately, it just gives you a chance to reset, refocus, and then kind of get yourself back to your basics and your baseline. The other mental aspect to pitching or to throwing in general is obviously having some body awareness, being aware of what proper mechanics are looking like, being coachable, and being willing to change and alter your mechanics based on what people or your coaches are showing you, or your pitching coach or whatever may come about, is just being willing to make changes and being able to make changes mentally, and not just sticking with this is what works for me. Because a lot of times what's working now is not going to work long term. You're going to have an injury or something like that. So there's going to be some changes that you need to make to help reduce stress, but it's going to ultimately long term improve your performance.
Yeah. When kids have quite a bit of anxiety about this, and it's starting to impact their quality of life, and they're not really enjoying themselves anymore, do you ever get psychology involved?
Yeah, great question, Mike. Sports should be fun. It's hard and it's challenging, but it really in the end should be fun. And if we have kids who are having trouble with anxiety or stress related to their sport, then it's definitely a good time to bring in a sports psychologist or someone or psychologist who's comfortable talking to young athletes. And the things that athletes experience are the same kind of things that everyone experiences. They're just experiencing anxiety or stress in the setting of their sport versus in other outside settings.
Yeah, Herm.
The other thing that I would say is burnout is real for our young athletes, especially when you get them specializing very, very early. We have kids who are as young as 8 and 10 years old specializing in baseball year round. They're spending all year round. They're traveling to camps, they're traveling to showcases, they're go on travel teams, they're on their spring, school team. They're seeing their pitching coach in the off season. They're seeing their hitting coaches throughout the season, and they get burned out. It's not when you notice that a kid's not having fun anymore, or they express that it's, they're stressed, or, that their sport, they don't seem to be enjoying their sport as much. That's a big red flag that we need to take a step back and just remember that they are a kid. And it's, you're not going to win a college scholarship when you're 10 or when you're 12. Sports should be fun. And if you burn them out early, they're not going to want to play when they get to high school or when they get to college. So all of that, trying to push, and that's on a lot of the parents and the coaches, especially. We got to remember that there's fundamentals, and then there's fun. And that's the main part that we should be remembering for our young kids.
Yeah, absolutely. Tom, tell us about the management of throwing injuries at Nationwide Children's Hospital. So if a family comes in and their kid has arm pain and they're a pitcher, it's a multidisciplinary effort, right? Tell us about the process of getting them diagnosed and treated and rehabbed.
Yeah, absolutely. Definitely you want to have a good team in place, and that team will include your physician and the folks who take care of them in the clinic. And then the second part of the treatment is the rehab team, such as Herm's team. And I always say, the physician's job is pretty easy. Herman and his team do all the heavy lifting on these kids by getting them pain-free, making them stronger. I always tell, when we talked about this earlier, when an athlete is faced with an injury that's going to take them out of their sport for a while, there is, coping issues. Sometimes the families too, they're very invested, as we've talked about. So what I try to do is paint the big picture for these athletes by resting you and getting you healed up the right way and sending you to a really good rehab program like we have here at Nationwide Children's. We're going to make you stronger because we're going to work on these areas where you haven't worked on to make you a better, stronger thrower. We're going to make you more skilled because Herm's going to find the problems in your throwing mechanics and help you fix those. And you're going to be smarter because you're going to know how to take care of your body better. You're going to know what to look for in terms of signs of injury. So I think you have to have a good team in place who understands the throwers, understands their specific sport. Again, we've been talking about baseball players, but we also take care of softball pitchers. And that's a different type of throwing mechanic. And again, you want to be able to take care of all types of throwers.
Yeah, absolutely. And then you guys, of course, take care of all sorts of injuries, also concussions. We've talked with the adaptive sports medicine folks in the past, sports nutrition, and you guys partner with area schools. So you're really involved in the community. Tell us a little more about just sports medicine in general at our hospital.
Yeah, so we definitely pride ourselves in taking care of the entire athlete, and not only the athlete, but helping parents through the process of getting kids healed back, and just having a really good rehab team, sports psychology, orthopedic surgeons. And we have 8 different sites around the city. There are 9 physicians in my group that are all certified in sports medicine. And we have some special niche programs, such as you mentioned, our adaptive program. So we really, we want to be available for kids of all ages and abilities, and not just the elite athlete, but even the weekend warrior or the kid who gets hurt on the playground.
Yeah. And we'll put a link to sports medicine at Nationwide Children's Hospital in the show notes for this episode 513 over at PediaCast.org, so folks can connect with you. We'll also have some other resources that you guys have put together, one on shoulder injuries in young athletes, another on elbow injuries in young athletes, and one on pitch counts and throwing injury prevention. Those are all in the form of articles and blog posts, and I'll put links to all of those things in the show notes so folks can read a little bit more about those. So once again, we really appreciate both of you stopping by, Dr. Tom Pommering, Chief of Sports Medicine at Nationwide Children's Hospital, and Herman Hundley, athletic trainer here at Nationwide Children's. Thank you both so much for being here today.
It's always great to be here. Thank you very much.
Thanks for having us, Dr. Mike. It's always a pleasure.
We are back with just enough time to say thanks once again to all of you for taking time out of your day and making PediaCast a part of it. Really do appreciate that. Also, thanks to our guests this week, Dr. Tom Pommering and Herman Hundley, both with sports medicine at Nationwide Children's Hospital. Don't forget, you can find us wherever podcasts are found. We're in the Apple and Google podcast apps, iHeartRadio, Spotify, SoundCloud, Amazon Music, and most other podcast apps for iOS and Android. Our landing site is PediaCast.org. You will find our entire archive of past programs there, along with our show notes, terms of use agreement, and that handy contact page if you would like to suggest a topic for the program. Don't forget, reviews are helpful wherever you get your podcasts. We always appreciate when you share your thoughts about the show. And we love connecting with you on social media. You'll find us on Facebook, Twitter, LinkedIn, and Instagram. Simply search for PediaCast. Also, don't forget about our sibling podcast, PediaCast CME. That stands for Continuing Medical Education. It's similar to this program. We turn the science up a couple notches and offer free continuing medical education credit for those who listen. Of course, that includes doctors, but also nurse practitioners, physician assistants, nurses, pharmacists, psychologists, social workers, and dentists. And since Nationwide Children's is jointly accredited by all of those professional organizations, it's likely we offer the credit you need to fulfill your state's continuing medical education requirements. Of course, you want to be sure the content of the episode matches your scope of practice. Shows and details are available at the landing site for that program, PediaCastCME.org. You can also listen wherever podcasts are found. Simply search for PediaCast CME. Thanks again for stopping by, and until next time, this is Dr. Mike saying stay safe, stay healthy, and stay involved with your kids. So long, everybody.
This program is a production of Nationwide Children's. Thanks for listening. We'll see you next time on PediaCast.